Welcome to our channel, where we bring you the latest health tips, medical insights, and practical advice to help you live a healthier life. If you are taking gabapentin, this video is especially important for you. Gabapentin is a widely used medication, but many people are unaware that it can dangerously interact with other medicines. Today, we will discuss 7 medications you must avoid if you are taking gabapentin. Before we begin, don't forget to like this video and subscribe to our channel for more life-changing health information. Now let's dive right into it. Gabapentin is commonly prescribed for nerve pain, seizures, restless legs syndrome, and sometimes for anxiety disorders. It works by calming nerve activity in the brain, which helps in reducing pain and seizures. However, when combined with certain drugs, gabapentin can cause severe side effects, ranging from excessive drowsiness to breathing difficulties. That is why knowing which medications to avoid is crucial for your safety. So here are the 7 medications you must avoid if you are taking gabapentin. Medication number 1, opioid painkillers. Drugs like morphine, oxycodone, and hydrocodone are powerful pain relievers, but when taken with gabapentin, they can severely depress your central nervous system. This combination increases the risk of extreme drowsiness, confusion, and most dangerously, breathing problems. In some cases, mixing opioids and gabapentin has even led to fatal outcomes. Therefore, never combine gabapentin with opioid painkillers unless strictly prescribed and monitored by your doctor. Medication number 2, sleep medications or sedatives. Common drugs in this group include zolpidem, also known as Ambien, azopiclone, or benzodiazepines like lorazepam and diazepam. These medicines work by slowing brain activity, helping you fall asleep or feel calm. But when you take them with gabapentin, the sedative effects multiply. This can cause extreme drowsiness, dizziness, memory issues, and impaired coordination. For seniors, this combination can increase the risk of falls and serious injuries. Medication number 3, alcohol. Yes, alcohol is not a prescription drug, but it is one of the most dangerous substances to consume with gabapentin. Both alcohol and gabapentin affect the brain by slowing down activity. When used together, they can cause overwhelming dizziness, fainting, and impaired judgment. In some cases, alcohol combined with gabapentin can suppress breathing, leading to life-threatening situations. Therefore, if you are on gabapentin, it is best to completely avoid alcohol. Medication number 4, antacids containing aluminum or magnesium. These include over-the-counter products like Maalox or Mylanta, commonly used for heartburn or indigestion. When taken at the same time as gabapentin, these antacids interfere with how the body absorbs gabapentin. This reduces the effectiveness of your medication, meaning you may not get the full benefit for your pain or seizures. Doctors usually recommend taking gabapentin at least 2 hours after consuming such antacids. Medication number 5, certain antidepressants. Some antidepressants, especially tricyclic antidepressants like amitriptyline or even selective serotonin reuptake inhibitors, may interact with gabapentin. When combined, they can increase side effects like dizziness, fatigue, and difficulty concentrating. In some cases, the interaction can also raise the risk of serotonin syndrome, a rare but serious condition. Therefore, always discuss with your doctor before mixing gabapentin with antidepressants. Medication number 6, muscle relaxants. Drugs such as cyclobenzaprine or carisoprodol are prescribed for muscle spasms and pain. But when taken with gabapentin, they can overly relax your nervous system. This may cause extreme drowsiness, low alertness, and difficulty breathing. Patients who take both are at higher risk of accidents and falls due to impaired reflexes. Medication number 7, antihistamines, especially first-generation ones like diphenhydramine. These are found in common allergy or sleep medications. When combined with gabapentin, they can lead to excessive drowsiness, blurred vision, and slowed reaction times. This combination is especially dangerous if you drive or operate machinery. So to recap, the 7 medications to avoid while taking gabapentin are opioids, sleep medications, alcohol, antacids with aluminum or magnesium, certain antidepressants, muscle relaxants, and antihistamines. Now let's talk about why these interactions are so dangerous. Gabapentin itself slows down nerve activity in the brain. When you add another drug that does the same thing, the effects are multiplied. This can overwhelm your brain and body, leading to confusion, poor coordination, and respiratory problems. In seniors, the risks are even higher because metabolism and organ function slow down with age. That is why doctors often adjust gabapentin doses carefully and monitor for side effects. If you are taking gabapentin, you must always inform your doctor about every medication, supplement, or even herbal remedy you use. Do not start or stop any drug without consulting your healthcare provider. Even something as simple as over-the-counter cold medicine can interact with gabapentin. Your pharmacist can also be a great resource in identifying dangerous drug combinations. Apart from medications, lifestyle habits also matter. As mentioned earlier, alcohol should be avoided completely while on gabapentin. Another important tip is to take gabapentin at the same times each day as prescribed. Do not increase or decrease your dose on your own, as this can lead to withdrawal symptoms or worsening of your condition. Always follow your doctor's instructions. Now let's discuss a few additional safety tips. If you ever feel unusual drowsiness, confusion, or trouble breathing while on gabapentin, seek medical attention immediately. Do not drive or operate heavy machinery until you know how gabapentin affects you. Store your medication properly and keep it out of reach of children. And finally, never share your prescription with anyone else. Each person's health condition is unique, and what works for you could be harmful to someone else. If you're really committed to improving your health, make sure to check the description below. I've shared some of the best tools and resources that I personally recommend for staying on track, building strength, and making progress faster. Now let's wrap up today's video. Gabapentin is an effective medication when used correctly, but it can be dangerous if combined with the wrong drugs. By avoiding these 7 medications and following your doctor's advice, you can use gabapentin safely and effectively. Always stay informed, ask questions, and take charge of your health. We hope this video was helpful for you. If you found this information valuable, please give this video a like and subscribe to our channel for more expert health content. Thank you for watching, and we'll see you in the next video. Stay safe, stay informed, and take care of your health.